although stents are great to be used acutely to safely get our patients out of the lab when they have a lot of recall or a vessel-threatening dissection, what we don't want is lots of patients with lots of metal at 5 or 10 years, because we know that there's an attrition rate that goes on at least to 10 years and at 2% or more per year. With the De Novo study, we would hope to prove that with the use of the solution balloon, that we can broaden the use of drug-coated balloons generally in all of our patients, and if we're using more drug-coated balloons and less stents, we will be avoiding the long-term complications that arise from stenting. Once you are comfortable with the concept of not putting stents in, and if you learnt about good lesion preparation and which dissections are safe to leave, you can then move into De Novo larger vessels. So it is a very gradual process.